Okay, so if I'm looking at, T10, right, and I wanted to do a latexian glide in this position, you can't really do this with any of the others because you're getting up too high, right? But at 10, you can manage to do this. So basically all we're gonna do is we're gonna try and position him into right latexian, right? And just test the end feel, right? So to do that, we would need to side bend him to his right. So we're gonna tilt the pelvis so that we can do that. Now, if I wanted to come from above as well, I could do that as well here. But I should just do a pure side bending, right? So instead of doing this sort of vector here where I'm gonna induce some sort of extension, rotation, we're just gonna do this. He's gonna stick to the table because he's got no shirt on. So we'll just tip that there instead. There we go, he can have that back. But at this point, we should be able to see a side bending curve on the T10, right? So we come back here, there it is. There we go. Right there. So we're gonna overpress that side bending, right? I'm gonna come from below to produce that, right? I'm just gonna bring that up into more side bending at T10, and then I'm going to pull him forward into what would be the left rotation. And that's all, that's it, that's all he gets, which really isn't much. Okay, so there's my confirmation. T10's jammed, we need to do something about this. Could I have had some sort of like capsular end feel, or maybe even a muscular end feel like that? Yeah, could have been. And then that would have been my treatment, right? Would have been just right here, working on that mobility. Make sense? Okay, that's pretty simple. We're gonna move down one segment. So there's my 10, we're gonna drop to 11. When I'm assessing T11, I wanna take the hip flexor out of it, right? So I'm gonna pull him all the way up into hip flexion here, just till I feel this flex. And then I'm just gonna drop it back there so that now I'm tighter through the lumbar spine and I have more slack on psoas, okay? Okay, now T11 should be very mobile, right? So I should be able to rock it back and forth. So if you're having a hard time landmarking at any point, T11 should be the one that you can kind of roll around like this, right? If I drop down to 12, it's not gonna rotate. If I go up to 10, it's not really gonna rotate, right? So there's 11. Now, my test here is I'm looking to take the two facets and just swing them around. All right, so I'm going to rotate him down to our barrier, and then I'm just going to test the glide. So that's our PAVM, that's our glide. If I came into that particular position and I found that it was stiff, if it's a capsular issue, soft tissue problem, then this is my treatment, right? I'm just mobilizing in that position. If, however, it was pathomechanical and it was jammed, I'm gonna take my thumb, put it on the upper side, so this is right side of the spinous process of T11. I'm gonna fixate T12 just like so with my middle finger here. I'm gonna come over the top and I'm just gonna manipulate down toward the table. Pure rotation, right? Probably one of the only pure rotation manipulations you'll do in this course. Very simple. No questions about that? Okay, good. Now T12, if we move back down to T12 here, in that area, we're going to want to recheck the ability of L1 to come up underneath that T12 segment. Okay, so in this position, the easiest way to do that is basically with a pure extension moment, right? So I've found that it's actually more effective if we produce a little traction and then an anterior superior glide of L1's facet, right? L1's articular process. So here and then up underneath that, like that. Again, just assessing for end feel. I think in most cases, this is the one that's most likely to end up with more of a capsular pattern than it would be a pathomechanical infield. But again, that's pretty consistent with most lumbar segments. Most lumbar segments, I'd say maybe only 10% of the time do I need to do a manipulation on a lumbar segment. Most of the time I'm just doing mobilization or some sort of muscle energy technique, something of that nature. So kind of adds up with the orientation that T12 L1 has. Okay, but if I did have a situation where I needed to do an actual manipulation here, you could do the manipulation right like that, right? Essentially looks just like an extension manipulation. Scoop it here, anterior superior, and then right down into it like so.